Imagine needing a repair to your smallest vessels. Well, that's where microsurgery comes in. 11 News anchor Lacey Griffith talked with a Mercy Medical Center hand surgeon about the procedure.
Well, now, I hope this doesn't happen to you, but in the case you ever cut off a finger, think about what it takes to repair that. The bones need to be put back together, as well as the tendons, and then a microscope comes into play when your vessels need reattached. Well, Dr. Katz says operating under a microscope has been done for decades, but the microscopes are getting better. Some of the conditions you may need hand microsurgery for include tendinitis, which he says he does see more in women than in men, and it happens at the base of the thumb, often called mommy thumb. Well, Dr. Katz says carpal tunnel also affects a lot of women and can cause numbness, tingling, and affect your sleep. He says the future of microsurgery is bright, and he sees the optics only getting better with the possibility of tackling even smaller vessels.
I think that there are technologies that have been around for a while. They just haven't really been adapted to microsurgery just yet that can help eliminate tremor. So there are robotic assist devices that can help the surgeon make their moves. So in addition to magnifying vessels, you can eliminate tremor, you can scale up and scale down movements and things like that.
Well, Dr. Katz says this could even also lead to remote operating. So think of a doctor wearing virtual reality and making the moves from somewhere other than the operating room, while the robot is actually working on the patient. We'll just have to wait and see. In the studio, I'm Lacey Griffith.
And Dr. Katz joins us now with more information. Good morning.
Hi, good morning.
I'm going to jump right into where that left
Sure.
off, talking about doing surgery while you're not even in the room. How would that even work?
Well, that's using a remote device, a special robot that allows the surgeon to sit in one location and operate remotely.
That is very cutting edge. And almost sounds a little scary too, but I guess, you know, with the future of medicine, you guys are already doing so many robotic surgeries, but I guess you're kind of like in there and you're looking at it. Would it be different to be in a different room, like for you as a surgeon?
It is a little different. Now, it's been researched in the field of microsurgery in particular. It is used pretty widely in the field of urology. So that technology exists. It's something that is being pushed forward. Moving the needle of medicine forward. It's not something that's routinely done in the field of microsurgery, but it's being looked at.
When we think about microsurgery, you and I were talking, and microsurgery can be done anywhere on the body, but you primarily focus on hand surgeries.
Yes.
And I just have to think about, you know, when we think about the phalanges, we think about how many bones are in there, how many like little tendons and vessels and things like that. How small are we talking?
You're on the millimeter scale.
Wow.
Yeah.
You have to have very steady hands.
Yeah, steady hands and the use of great optics. So we typically will use a microscope to sew small things together, small arteries, veins, and nerves.
And microsurgery can be done on men and women, but there are issues that affect women in their hands primarily more than men. That's
true. Yes, in the realm of hand surgery, we will see a lot of carpal tunnel around pregnancy, a lot of tendinitis around the base of the thumb. When women have young kids that they're caring for. So there are some issues particular to women that pop up in the field of hand surgery.
Is trigger finger one of those things that you could potentially have to have surgery for?
Yes.
Wow.
Yeah, trigger finger is a very common problem, very treatable. Sometimes we'll try a steroid injection. If steroids don't work, we'll progress to surgery.
So just thinking about, you know, you mentioned the word progress, the way things are progressing, we talked about obviously you guys used to just use your hands, now you're using the robotics, now we're thinking about, you know, being in a different room. How excited are you about the way technology is progressing in specifically for microsurgeries?
Yeah, that's a great question. I mean, things are always getting better. Our technology is advancing, our optics are getting better, our ability to eliminate tremor with certain robotic assist devices there. It's a very exciting time to be in the field.
And why is this better for the patient? Does it just improve outcomes?
I think anything that can augment the surgeon's knowledge and skill has the ability to help the patient.
Yeah. Anything else you want us to know about these surgeries?
Well, I'm very excited about hand surgery and being able to take care of people and help those in need. I think it's a wonderful career.
Yeah.
It's a great thing to do.
What got you into hand surgery?
Oh, that's a great question. I like the mechanical aspect of it.
Oh. I could see that.
Yeah, it's very neat. And sometimes we'll do surgery with patients awake. They'll come in unable to move a finger, and you do your procedure, and on the table they can show you that they can move their finger again. And it's very rewarding. It's rewarding to the patient, rewarding to the doctor.
That sounds like very gratifying too. You can like immediately see
Yes.
that you've helped fix something so
Yes.
important.
Yeah, that's called wide awake surgery. It's very exciting.
I love that.
Yeah.
Well, thank you so much for coming in and talking with us.
Thanks for having me.
Yeah, of course. And if you have any other questions or would like a referral, call 1-800-MD-MERCY. Stay with us. We'll be right back.